Hello and welcome back to the HIVRNAtestguide.com YouTube channel, your trusted source for HIV testing with over 4,500 HIV testing labs across the United States. For more information, check the link in the description of this video or the bio section of our channel.
Okay, let's unpack this. We often talk about global health policy in these, very abstract terms.
Right, from 30,000 feet.
Exactly. We're tracking international agreements, major funding bodies, but today we're zooming right in.
All the way in.
All the way into a single, densely populated mega-city Lagos state, Nigeria, and a really remarkable set of policy announcements that I think it really shows what integrated public health leadership looks like on the ground.
It's such a compelling case study, and it's because they are refusing to treat the HIV epidemic as, just a siloed medical issue.
It's not just about pills and clinics.
Not at all. Lagos is committing to this dual strategy that is just inherently holistic. They're addressing the immediate concerns of human dignity and at the same time long-term infrastructure sustainability.
In all of this, while they're preparing the groundwork for a massive future medical breakthrough, it's a lot to tackle at once.
It is a huge undertaking.
And our sources for this deep dive, they're rooted in a December 2nd, 2025 report from the Gildan. It captured the key commitments made during the 2025 World AIDS Day Symposium. And what's so extraordinary here is that this isn't just a discussion of statistics. It's infrastructure, budgeting, legal accountability, future logistics, all rolled into one big declaration.
It really is. So our mission for you today is to unpack this highly integrated approach. We are going to see Lagos commit to fully enforcing existing legal protections now against HIV stigma.
That's the dignity piece you mentioned.
That's their commitment to dignity, exactly. And while they do that, they're simultaneously putting the operational, the financial, and the logistical groundwork in place for 2026 HIV vaccine rollout.
So they're fighting the current crisis while banking on the future of medical science.
You've got it. They're playing both the short game and a long game.
And if there's one initial takeaway, the thing that really signals the seriousness and sort of the foundational shift in this administration, it's that commitment to fully enforce the existing anti-discrimination law.
Yep.
It just sends such a clear tone right from the top. Compassion has to prevail over fear and judgment in Lagos State if they are ever going to get ahead of this epidemic.
That is the essential foundation. It has to be. Public health cannot progress faster than social acceptance.
Yeah.
If we look at the history of HIV epidemics globally,
It's the same story everywhere.
it's the same story. Without reducing that crippling weight of stigma, all the testing, all the treatment, even of a future vaccine, it's all going to hit a brick wall of fear, isolation, and denial.
So Lagos is starting by basically legislating a necessary environment.
Yes, an environment where medical adherence is encouraged, not punished.
Okay, so let's start with that legal foundation because it feels like the most immediate, the most forceful action item that was detailed in the source material.
I agree. It's the bedrock for everything else.
So at the Civic Center on Victoria Island, we have Governor Babajide Sanwo-Olu, represented by the Secretary to the State Government, Abimbola Saduhundain, making this explicit promise. Full enforcement of the existing human immunodeficiency virus anti-discrimination law. This isn't just, repeating a nice policy. This is a mandate for action.
It absolutely is.
Yeah.
And that shift in language from just having a law on the books to promising full enforcement, that means they're signaling a massive change in posture.
So it's not just symbolic.
Not at all. It's moving toward actively investigating and prosecuting violations. For people living with HIV, or PLHIVs, this signals that the state is finally taking their civil rights seriously. The law itself is specifically designed to protect residents from these systemic, everyday injustices.
Can you elaborate on the specifics of what that law covers? When we talk about anti-discrimination in this context, what tangible things is the state really aiming to prevent?
Well, the law is designed to prevent discrimination across the foundational pillars of social and economic life. So residents should not be shamed, they shouldn't be isolated, or, and this is the most critical part,
Denied opportunities.
denied opportunities simply because of their HIV status. This covers employment. You can't be fired or denied a job offer based on your status. It covers housing landlords can't evict tenants for it.
And education, public services.
All of it.
Yeah.
Access to education, public services, stigma erodes these pillars, you see. It forces people underground and it traps them in these vulnerable circumstances where they're much less likely to seek or adhere to treatment.
That makes so much sense. I mean, if you remove the threat of losing your home or your livelihood.
The existential threat.
Right. It removes the existential risk that's associated with it just engaging with the health system in the first place. If the law protects your economic stability, you are just so much more likely to prioritize your physical health. Here's my question.
Okay.
Enforcing anti-discrimination laws is notoriously difficult. I mean, especially in really sensitive areas like health status disclosure. How is Legos planning to move this from just a promise to a reality? Who actually investigates these claims?
That's a critical challenge. And the complexity is precisely why they emphasized enforcement, rather than just, say, policy revision. It requires specialized legal and operational mechanisms.
So not your average police work.
No, not at all. In many jurisdictions with these kinds of laws, the process usually involves establishing a dedicated enforcement unit. Often it's linked to the Ministry of Justice or a specialized human rights commission.
And these units would be trained specifically for this?
Exactly. They are trained to handle the sensitivity and the confidentiality that's required for health status cases. So it's not just relying on the general police force, but having people who understand the public health nuance.
They need that expert capacity.
They do. And furthermore, they have to rely heavily on civil society to serve as monitors. And this takes us directly to the why behind this whole aggressive enforcement drive. It goes beyond simple justice, although, that is paramount. But it's profoundly about public health outcomes. By protecting the rights and dignity of PLHIVs, they foster a supportive healthcare environment. When people trust the system and they know they won't be ostracized,
they're far more likely to seek care
and test regularly and adhere to treatment.
And adherence is just the absolute key. It's key to both individual health and community prevention. If a person living with HIV is consistently in care and taking their antiretroviral medicines, their ARVs, they can achieve viral suppression.
That is the ultimate public health goal, and we should probably elaborate on that for you, the listener.
Please.
Viral suppression means the level of HIV in the blood is so low that standard tests literally cannot detect it. And the dual benefit here is just enormous.
Okay, so what are the two benefits?
First, the person themselves remains healthy. That's the individual benefit. But second, and this is revolutionary, a person with sustained viral suppression cannot sexually transmit HIV to others.
This is the UU concept.
This is U. Undetectable equals untransmittable. And stigma prevents people from reaching U to SU. So the enforcement of this law is literally a prevention strategy in itself.
I see the direct link now. It's so clear. Legislating dignity facilitates biological prevention. That's a powerful connection.
It is.
And the source material highlights that the governor recognized the government can't achieve this outcome alone. They emphasized a massive call for collaboration.
Which is smart.
So who did they specifically name as necessary partners in this?
This really speaks to the sophistication of their strategy. They are targeting every single layer of society that can either perpetuate stigma or help dismantle it. They cited civil society networks, the media.
Which is so vital for accurate messaging, right? Countering misinformation.
So vital. They also named community leaders and faith-based organizations.
And they specifically mentioned the networks of people living with HIV, particularly the network of NEPWAN.
Yes, the network of people living with HIV. Naming NEPWAN is absolutely essential.
Why is that so important?
Because that organization is the backbone of advocacy and support for PLHIVs in Nigeria. Their involvement ensures that the anti-discrimination law is grounded in the lived experiences of the community it's meant to serve.
So they're not just making policy in a vacuum.
Exactly. NEPWAN functions as a critical discrimination watchdog. They provide immediate feedback to the state on where the law is failing or where it's succeeding. They are the voice that prevents the policy from becoming divorced from reality.
The report also noted private sector actors and development agencies, and that, to me, indicates a recognition that workplace discrimination, especially in a dynamic economic hub like Lagos, is a massive problem.
Oh, absolutely. Right. The private sector needs to understand their legal obligations, and not just through some generic compliance training video, but through specific guidelines issued in collaboration with the state. Yeah. And by including development agencies, they are ensuring that international funding and technical expertise are aligned with the state's primary goal, which is reducing stigma as a public health priority. The goal is to make this anti-discrimination law a visible, active part of Lagos society.
So if you synthesize all these collaborative efforts and the enforcement mandate, What is the administration's stated vision of care? What does success actually look like under this new enforced legal framework for, the average person living with HIV and Lagos?
The administration's vision, as it was stated in the report, is highly aspirational but also very specific.
Okay.
They are committed to building a city where PLHIVs can access health care without fear.
Without fear, that's the key.
That's the key. Where they can remain consistently in care and benefit from innovative, compassionate support systems. And the driving force behind all of this is the commitment that no one is left behind regardless of circumstance.
So success means eliminating those social barriers.
Exactly. The barriers that lead to erratic treatment adherence, which, as you noted, compromises individual health and contributes to drug resistance across the entire community.
It sounds like they are creating a necessary precondition for all of their future success. They are essentially saying, before we introduce the next great medical breakthrough, we first have to fix the broken social environment that prevents people from even accessing what we already have.
That is the strategic importance right there. Law enforcement in this context is arguably the most powerful tool for improving public health outcomes that Lagos has right now.
Yeah.
It is the lever they have to pull to reduce fear, promote early diagnosis, and guarantee the retention of patients in these long-term treatment protocols.
Okay, so we've established this strong legal and, frankly, moral foundation that they're building. But how high is the wall of fear and transmission that they're trying to dismantle?
Yeah.
The raw data presented at the symposium gives us a really stark answer, and it transitions us perfectly from this policy of dignity to the urgency of epidemiology.
It does. And the symposium's theme itself sets that tone of challenge.
Right, overcoming disruption, sustaining Nigeria's HIV response.
That theme implies that just maintaining the response is not a passive activity. It requires proactive effort against external challenges, whether those are economic instability, political shifts, or even global resource reallocation. And the data they presented confirms exactly why this intensified effort is necessary.
So what's the critical, tangible data point, the one that brought home the urgency at this symposium?
The governor revealed a very specific and highly concerning infection figure. Yep. 9,467 new HIV infections were recorded in Lagos State just from January to September of 2025.
Wow.
It's a 9-month window in a single state. It provides a very precise, very recent metric of ongoing high-level transmission.
Almost 10,000 new infections in just 3/4 of a year. That is a powerful, tangible figure. It instantly justifies the intensity of their legal and their logistical response.
It does.
But we have to ask, is this figure purely high because of, say, better testing and surveillance, or does it represent a truly active transmission chain?
That's a fair and critical question. And while, sure, improved surveillance might contribute to better reporting, a figure of this magnitude cited publicly as a catalyst for a whole new strategy.
It suggests a truly active epidemic front.
I think so. And the analysis the governor attached to that figure is telling. He described it as a stark reminder of the urgent work still ahead. This number is what directly drives the need for this immediate, multifaceted strategy implementation.
This level of ongoing transmission suggests that the existing prevention methods, education, condom distribution, current testing campaigns, they're just not penetrating enough. Or maybe...
Or perhaps the social conditions we just discussed, the stigma and the fear, are actively undermining them.
Right.
That's the correct analysis. This data tells policymakers two things. One, the disease is still spreading quickly. And two, whatever they are currently doing isn't reaching critical mass. This number is the direct justification for all the long-term expensive planning, including the vaccine preparation we're going to cover later.
It confirms that the status quo is not an option.
Not at all.
So in response to the pressure of those 9,467 new infections, the governor stressed 3 immediate critical pillars of action. How do these 3 pillars directly address the current reality?
Well, the first pillar is fundamental. Prevention strategies must be strengthened. This means Lagos is actively evaluating and likely seeking to scale up advanced prevention options.
Like what?
Possibly including expanded access to pre-exposure prophylaxis, or PUP.
Which is highly effective.
Highly effective, but it's often underutilized due to cost or awareness barriers.
And the second pillar directly bridges the data back to the legal section we just covered.
Absolutely. The second pillar is that stigma must be decisively tackled. And the word decisively there is key.
Why that word?
It indicates an understanding that, soft messaging around compassion hasn't worked sufficiently. And now, forceful legal intervention and community education, backed by actual sanctions, are required to remove this social impediment to public health.
So it recognizes stigma as a measurable obstacle to epidemic control.
Exactly.
And the third pillar, that addresses the structural instability that's implied by the symposium's theme of overcoming disruption.
That's right. The third pillar is critical for their operational resilience. Access to testing and treatment must be protected from disruption, irrespective of external challenges.
So this is the government recognizing that global instability, economic crises, geopolitical shocks, and even other pandemics can interrupt the supply of these life-saving medicines.
It's an explicit mandate to protect the supply chain.
And that focus on protection is so crucial. An interruption in the supply of antiretrovirals, even for a few weeks, can be catastrophic.
Oh, it can be. It leads to patient failure, it leads to drug resistance, and it can reverse years of public health progress.
So it's not just a logistical problem, it's a medical one.
Precisely. If patients stop taking their ARVs and then they restart, there's a serious risk that the virus may have mutated and become resistant to that specific drug cocktail.
And then you have to switch to more complex, more expensive regimens.
More complex, more expensive second or third line regimens. So protecting access isn't just about human kindness. It's about maintaining the efficacy of their entire drug arsenal.
When you combine the data, that 9,467 new cases in 9 months, with those three pillars, you really see a comprehensive and aggressive action plan forming.
It's entirely data-driven. The magnitude of the new infections justifies the intensity of the policy. And ultimately, this whole section just reinforces the administration's firm resolve to reduce the burden of the epidemic to the barest minimum. That's the immediate, aggressive goal that requires the integration of legal, logistical, and medical strategies.
Okay, so the urgency of that infection data, coupled with the mandate to protect access from disruption, it leads us directly into what might be the most fundamental infrastructural and policy pivot mentioned in the source material. The strategic move towards self-sufficiency in medicine supply. This feels like a dramatic shift away from donor dependence.
It's truly a major philosophical statement. It's a declaration of public health autonomy. The source confirms that Lagos State has begun taking concrete steps toward the domestic procurement of antiretroviral medicines, ARVs.
And that is so much more than just signing a new contract.
Oh, much more. It's about building a robust, state-led supply infrastructure from the ground up.
And we really have to dissect the rationale here. Relying on global aid things like PEPFAR, the U.S. President's Emergency Plan for AIDS Relief, or the Global Fund, that's been the foundation of HIV treatment in many developing nations for decades.
It has been, yes.
So why is Lagos now making this expensive and very complex decision to pivot away from that model?
Well, the administration's stated position is both clear and strategic. Donor dependence, they say, cannot form the foundation of Lagos's healthcare future.
It's a rejection of vulnerability.
That's a great way to put it. It is. While international aid has been life-saving and absolutely essential, relying perpetually on these external funding sources introduces an inherent risk.
What kind of risk?
Donor priorities can shift, often based on political cycles in the funding nation. Funding can be arbitrarily cut, and supply lines are subject to global supply chain pressures that Lagos has no control over.
So in essence, they're saying that external aid is an excellent emergency solution, but it's a poor long-term foundation for essential medicines. They're buying back control to secure stability.
That is the core of it. Think of it like a country relying on imported food versus ensuring its own domestic food security.
Right.
If a global crisis shuts down trade, the imported food vanishes and you could have a famine. If Lagos relies entirely on imported donor-funded ARVs, any global disruption,
Like another pandemic.
like a pandemic that shifts manufacturing capacity elsewhere, or a geopolitical conflict, it could instantly disrupt the treatment of hundreds of thousands of their residents. And this is a risk they're just no longer willing to tolerate.
So the immediate goal is to build a state-led, sustainable treatment system. What does that look like practically? And what is the guaranteed outcome they are aiming for?
Practically, it means negotiating direct contracts with local or regional pharmaceutical manufacturers, maybe even investing in local production capacity. And it means setting up dedicated state budgets, not relying on grant cycles.
And the primary function of all that?
The primary function is to guarantee uninterrupted and equitable access to care for all residents.
Interruption is the enemy here. We discussed the risk of drug resistance if ARVs are stopped. So by localizing procurement, they're essentially taking out an insurance policy against that.
Exactly. An insurance policy against drug resistance and for maintaining the effectiveness of their entire treatment program. And the source highlights the particular importance of this self-sufficiency during periods of global uncertainty.
That phrase, while a bit vague, it really acknowledges the modern reality of these volatile supply chains.
It does. I mean, we saw it during the COVID-19 pandemic, how quickly wealthy nations prioritize their own domestic needs, leaving developing nations struggling to access essential commodities, including specialized pharmaceuticals.
So by localizing, Lagos is building robustness directly into its healthcare future. If the next global crisis pulls resources or manufacturing capacity away from HIV treatment, Lagos can ensure its citizens' ARV access remains insulated.
The financial commitment here is enormous, and we have to acknowledge that challenge.
I was just about to ask, surely the cost is astronomical compared to subsidized drugs.
It is. Self-sufficiency often means much higher upfront costs. But Lagos is clearly prepared to sacrifice those short-term financial savings in exchange for institutional resilience and guaranteed long-term stability. This is a massive shift in governance.
And it also has the potential added benefit of stimulating the local pharmaceutical sector, right? It could create jobs, ensure capital stays within the local economy, stabilizing the system even further.
It's a strategic move that affects both public health and economic development. It's institutional ownership of the public health crisis.
So they're recognizing that consistent ARV access is a fundamental right.
A right that must be funded and secured locally, not viewed as some philanthropic handout that's dependent on foreign goodwill. This move elevates HIV care from a variable program to a fixed, permanent infrastructure commitment.
That foundation of sustainability and legal protection is clearly essential because the state is simultaneously looking far, far ahead. And this leads us to the most future-focused aspect of the announcement.
The really ambitious part.
The plan to deploy an HIV vaccine in 2026. This is a massive, proactive commitment, and it's in direct response to those rising infection rates we talked about.
It's the ultimate expression of preparation meeting opportunity. With those 9,467 new infections in 9 months, Lagos is saying, we can't just wait for a cure, we have to prepare for the preventive breakthrough.
They're banking on the future of medical science.
They are. That a globally approved HIV vaccine will become available soon, and they intend to be ready on day 1 for mass deployment.
Okay, but a 2026 rollout, that sounds incredibly ambitious. I mean, especially considering the current global regulatory hurdles and the inherent complexities of rolling out any novel vaccine. Is Lagos relying on specific trial data for this timeline, or is this more of a philosophical statement of readiness?
That skepticism is well placed. They're clearly anticipating regulatory approval within the global scientific community in the next 2 years. Given the long history of HIV vaccine development, this preparation is a significant risk.
But one they feel is justified.
Justified by their urgent infection data. Furthermore, they are essentially signaling to manufacturers and global bodies that Lagos is ready, it's budgeted, and is able to participate immediately in any global allocation discussions.
So this isn't just a hopeful mention in a speech. The report details concrete steps the state is already taking to ensure readiness. And this shows a depth of operational planning that's crucial for you, our listener, to understand.
Exactly.
So what are those comprehensive steps that move this from just hope to actual planning?
There are 4 key, detailed areas of preparation that are already in motion. First, structured training programs.
Which goes beyond just a simple orientation, I imagine.
Oh, way beyond. This speaks to retraining thousands of healthcare workers, from injection nurses to data analysts on new protocols, safety monitoring, administration techniques for a novel product, and the logistics of handling incredibly high volumes.
Training is always the most time-consuming and, frankly, often the most neglected part of a successful rollout.
It is. If your staff aren't confident and meticulously trained, the whole program stalls or you risk safety incidents.
And the training must also cover that delicate issue of public trust, right? It links back to the anti-stigma effort.
Absolutely. Staff need to know how to administer the vaccine while maintaining the confidentiality required by law.
Okay, so training is number 1. What's the second step?
The second step is stakeholder engagements. This links back to the partnerships we discussed in Section 1. They need deep coordination with faith leaders, community organizations, and FPHWH to build robust community trust and proactively counter misinformation before the vaccine even arrives.
So if the legal framework removes the fear of discrimination,
the stakeholder engagement removes the fear of the medical intervention itself.
that's a great way to put it. Okay, what's step 3?
The third step, and this is the one that proves this isn't just talk, is budget planning. You simply cannot launch a rapid, equitable rollout of a new product without the necessary funds allocated and ring-fenced years ahead of time.
So procurement costs, storage, compensation for the massive workforce surge.
All of it must be set aside now. Budgeting ahead of time means that when the vaccine becomes globally available, Legos won't be caught flat-footed waiting for external grants or emergency appropriations.
Or, critically, competing with wealthier nations who have already cut the checks.
Precisely. And that leads directly to the fourth step, full procurement readiness.
And full procurement readiness in a place like Lagos, which is highly dense and tropical, must mean addressing some massive logistical hurdles. What does full procurement readiness actually entail in terms of infrastructure?
This is where the technical details really come into play. It involves establishing or upgrading the cold chain infrastructure.
Right, because unlike ARVs, which are mostly stable,
Which are generally stable at room temperature, many of the potential vaccine candidates require precise, sustained refrigeration, often 2 to 8 degrees Celsius or sometimes even deep freeze temperatures.
and maintaining that cold chain across the entire supply line, from the port through central storage, all the way down to the mobile testing units in intense tropical heat, that's an immense engineering and logistical challenge.
It's huge. It requires specialized freezers, a reliable power supply or backup generators, temperature monitoring systems, and trained personnel at every single storage point. That is a massive investment in institutional infrastructure.
So the intention here is clear. They are preparing for a rapid, safe, and equitable rollout.
Exactly. In a mega city of 20 million people, rapid means having hundreds of distribution sites ready to deliver high volumes daily. Safe means meticulous tracking of every single dose. And equitable, that's the hardest part.
Ensuring it reaches every corner of the city.
Especially the vulnerable and underserved populations that they've identified in their outreach plans.
The scale of this 2026 plan is essentially treating the arrival of an HIV vaccine as if it were a declaration of war against the virus. It's a whole-of-state commitment to deployment.
It is. They're using the current urgent infection rate as the primary motivator to plan for a post-ARV future, where prevention is provided through a massive vaccination campaign. It creates this powerful link between short-term crisis management and long-term vision.
They're connecting the enforcement of dignity
With the logistics of supply.
and the preparation for medical innovation. They are saying, we will stabilize our supply, we will protect our citizens' rights, and when the breakthrough comes, we will be the first to maximize its impact. So, the legal framework is being enforced, the infrastructure is secured for sustainability, and future plans are budgeted. But all of this, it relies on effective deployment on the ground. It relies on reaching the people where they actually live and work. And this brings us back to the operational side. The governor's promise that community programs will not only continue, they will expand.
And this is where that high-level policy has to translate into tangible, accessible care. In a place as vast and diverse as Lagos, you cannot wait for people to come to a central clinic. You have to take the services to them.
So the commitment to expansion ensures that the stability gains made through legal protection and procurement are felt directly by every resident. Let's detail the specific channels of outreach that are going to be intensified, because targeting specific environments really speaks to addressing the behavioral and geographical challenges that allow the virus to keep spreading.
The administration has listed 4 key areas of intensified outreach, and each one is highly strategic.
Okay, what's the first one?
First, mobile testing units reaching more communities. Mobile units are crucial for overcoming geographical barriers, yes, but I think more importantly for providing greater anonymity.
And reducing that public fear.
Reducing the public fear associated with going to a designated HIV clinic.
That directly addresses the stigma issue from Section 1. If the testing comes to you discreetly, maybe in a nondescriptive vehicle in your neighborhood, the risk of being seen, of exposure and subsequent discrimination is significantly lowered. It democratizes access.
Absolutely. And the units are also agile. They can be deployed rapidly to areas that have been identified as hotspots by that infection data.
So those 9,467 cases are being mapped.
They're being mapped, showing exactly where the response needs to be most concentrated.
Okay, so mobile units. What's the second area of expansion?
The second area is deepening youth interventions. This is critical because the new infections, those nearly 10,000 cases, are often concentrated in younger demographics.
So you need effective, tailored, preventative education.
You do, and this requires moving beyond, didactic lectures in a classroom and into peer-led, contextually relevant messaging about transmission, about prevention like PEP, and about the reality of living with a virus in the age of you anyway.
They are essentially investing in the long-term health and behavior of the next generation of adults, recognizing that the current educational methods just aren't keeping pace with the virus.
Precisely. Now, the third focus is fascinating in a city like Lagos. Intensifying outreach to market and transport hubs.
Okay, so why specifically focus resources on those areas?
Well, market and transport hubs are highly transient, high-volume locations. Think of major bus terminals, ferry crossings, and these large, bustling markets.
And these sites are populated by workers who might not be permanently settled or who work very long, irregular hours, right?
Exactly. Making a standard 9-to-5 clinic visit completely impossible for them.
That's the strategic genius of it. Reaching traders, long-distance drivers, conductors, commuters right there. It ensures that these vulnerable, highly mobile working populations aren't missed by the safety net.
It's smart public health geography. You're targeting the arteries of the city where human movement is highest and standard access is lowest.
Okay, so that's 3. What's the final channel?
The final channel listed is increased involvement from faith partners.
Yeah.
And this is essential in a society where faith-based organizations hold tremendous social and moral influence.
So faith leaders can be either major barriers by perpetuating judgment and stigma,
or they can be powerful allies in promoting acceptance and consistent care.
and by increasing their involvement, Lagos is utilizing an established, trusted network to spread accurate, science-based information and to counter judgment right at the community level.
It provides a kind of community penetration that the government infrastructure simply cannot achieve on its own. They are enlisting these partners not just for distribution, but for advocacy, to help reinforce the message that the law supports dignity and that seeking care is a moral imperative.
All these outreach strategies, the mobile units, the youth focus, market hubs, faith partners, they're all aimed at making essential care truly ubiquitous. And the source closes with this really powerful statement from the governor regarding this commitment to community care. A statement that just ties the entire strategy together.
It does. That closing statement serves as the final non-negotiable mandate for the entire operational strategy. The governor stated, "No disruption will ever again be allowed to disconnect our communities from essential care."
That language, no disruption will ever again be allowed, it's incredibly powerful.
It is.
Because it summarizes the entire integrated strategy. It addresses the urgency driven by the new infection data. It addresses the legal enforcement, removing the disruption of stigma and fear. And it addresses the sustainable procurement strategy.
Removing the disruption of external funding shifts and supply chain volatility. It frames continuity of care, backed by state-led infrastructure, as a non-negotiable right. This is Lagos declaring institutional ownership over its HIV response, moving beyond a temporary program reliant on external variables and establishing a permanent, resilient safety net for its residents, regardless of what turbulence exists in the global environment. So let's synthesize this expansive deep dive for you, the listener. Lagos' strategy, which is driven by that stark reality of 9,467 new infections in just 9 months, is a comprehensive 3-pronged attack. It's designed for both immediate impact and long-term resilience.
The first prong is legal protection, the full aggressive enforcement of the anti-stigma law, creating a space of dignity, of reduced fear, and thereby making it safe for people to actually achieve viral suppression.
The second is infrastructure sustainability, that major policy shift toward domestic ARV procurement, which ensures uninterrupted, equitable care regardless of global uncertainty or donor funding volatility. This is all about institutionalizing resilience.
And the third prong, that's the proactive future planning, intensifying budget allocation, training programs, and cold chain procurement readiness now for a rapid, safe, and equitable HIV vaccine rollout that they have planned for 2026.
This isn't passive management.
Not at all. It is aggressive, integrated preparation for a medical future they are banking on.
What stands out most profoundly to me is the underlying commitment to self-reliance. The rejection of donor dependence for essential ARVs. It just signals such a strong, independent commitment to public health that centers control and resilience within the state itself. They're building a system designed not just to treat, but to endure any future global shock.
In this entire approach, it's built on the fundamental understanding that dignity has to precede access. If you don't aggressively guarantee the rights and the confidentiality of people living with HIV through the law, all your complex medical advancements and your logistical plans will fail to reach the populations that need them most.
And that leads us to our final, provocative thought for you to ponder. Lagos is spending significant capital and political will to enforce these anti-stigma laws before a major medical intervention, like a vaccine, is even fully available. So how does a strong, localized commitment to enforcing dignity fundamentally change the effectiveness and the uptake rate of future public health innovations? If that barrier of fear is aggressively removed, how much faster and how much more successfully can true epidemic control be achieved once the necessary medical tools finally arrive?